Hi, this is Dr. Aidoo of the Department of Anatomy and Cell Biology, School of Medical Sciences. I come your way again with the part 2 of the female reproductive system. We want to cover that of the oviduct or fallopian tube and uterus. So we want to look at the major parts of the oviduct, and it spans from the lateral side all the way to the medial side, from this region to that. That is the fimbri, that is the infundibulum, then the ampullary region, which is the longest, region of the fallopian tube and where fertilization usually occurs. That is the isthmus, and then the interstitial or intramural part of the oviduct. They exhibit different histological architecture, i.e., being the lumen, dimension, or fimbri extensions, or the smooth muscles surrounding them. So they are all relative, and you can use this to distinguish between them. So for the fimbri and infundibulum region, they are going to have a lot of projections into the lumen. Then as you move towards the uterus, these finger-like projections will reduce. Okay, being towards the interstitial part, they are well reduced. Then you also have smooth muscles, increasing from lateral to medial as you move towards the uterus. So histologically, you find this to be the fimbri portion with all these projections to capture the egg. And then you have these extending towards the ampullary region, as you can see there, with a very thin, smooth muscle. Okay. Ampullary region, you can see the projections into the lumen, and then also a thin lining of smooth muscle. It's also ampullary region. And remember, the ampulla is the longest part, so it's going to span across and will have some characteristics of both the infundibulum and those of the interstitial or the isthmus, especially. You have these smooth muscle and the finger-like projections within the lumen. So at the isthmus portion, you can tell that the finger-like projections are reducing, the lumen are looking larger, and then smooth muscles are increasing, okay, all around. Uterine segment of the oviduct, so that's smooth muscle, a lot of them there, have blood vessels also. So you can see finger-like projections as we saw in the infundibulum and then the ampulla. So these are the finger-like projections that were masking the lumen. Okay, this is at high power, so we are actually looking at the individual finger-like projections, and then cilia that are even mounted on their lining epithelium. Okay, and this will help propel the zygote towards the uterus. So this will be a luminal portion. So in the uterus, you are having the two major parts here, endometrium and myometrium. Also have the perimetrium outwardly. The endometrium will be made up of the stratum functionalis and stratum basale, which will contain a lot of the glandular portions of the uterus. So the serosa or adventitia, the myometrium is mostly where you have a lot of smooth muscles and connective tissue. All right. So the endometrium will have the epithelium simple tubular with a simple columnar, and then the tubes are going to lead into the secretory portions of the gland. So you can have simple columnar epithelium with some simple tubular glands. Then you have the functional layer, and then the basal layer, which is also known as the stratum functionalis, stratum basale. The functional layer, which is usually sloughed off during menstruation, the basale is maintained to regenerate the functionality that has been sloughed out with the menstrual blood. We also have this blood supply with the uterine arteries in the broad ligament, which will supply the myometrium. You have arcuate arteries, which arch and branch in the middle muscular layers. You have straight arteries, which will supply the basal layer. Then cord arteries, which will supply the functional layer. So this is a very nice section of the uterus. That will be the lumen. So this will be the lining epithelium. Then as you move outward, you get to the myometrium. So this is endometrium. With these two parts, we expect to have stratum functionalis at the most superficial part, and then stratum basale will be more inner towards the myometrium, where you have a lot of smooth muscles. All the spaces you find there are actually ducts that lead into glandular regions. Okay, so all these are glands within the endometrium, endometrial glands. So that is a drawing. That's the surface epithelium, and then it invaginates as a gland. So that will be the duct, and that will be the secretory portions of the gland. That is what is depicted here. So you can see the duct system of the gland, and these are at different stages. So this is late proliferative, early secretory, late secretory. So you have them in this portion at different, stages. More zigzag as you get to the late secretory portion, and then slender as you come to the early portions. So endometrium menstrual cycle, around day 5, we take the menstrual cycle to be the one that ends by day 5. This is what you are going to have. It means that the stratum functionalis has been sloughed off. That is stratum basale left by day 5. Okay, then that is the myometrium. So this is also day 5, showing only the stratum basale left functionalis is gone. That is myometrium. These are some sections or remains of the glands that are found within the stratum basale. Most of the ones in the stratum functionalis have been sloughed off. So by day 7, it means that you are proliferating now to, get back to normal. So you have stratum functionalis reappearing, okay, with some of the glands, opening up into that region. Remember, we maintain the stratum basale to refurnish that of the functionalis. That is myometrium with a lot of smooth muscles. By day 9, a lot of the proliferation has gone on, and you are actually getting closer and closer to another stage, which will be fully formed and functional, as you can see. Then by day 14, you have the zigzag or shark tooth, appearance showing as far as the glands are concerned. So even the shark tooth is more intense. By day 28, you can see all the zigzag nature. So now you are not seeing tubular nature of the glands. They are actually coiled. Okay, very, very coiled. Thank you very much.